In the previous video, we mentioned the two different types of patterning of fat. Android obesity is where you pattern your fat around your abdomen. It's reflective of visceral fat, and it's a strong predictor of cardiovascular disease, diabetes, hypertension. And then the genoid obesity is more pear-shaped. People who pattern their fat in their hips, their buttocks, and their thighs. Even though that they have increased fat on their body, it is not strongly related to morbidity or those increased risks for cardiovascular disease and diabetes. So visceral fat is fat that is surrounding your organs and affects the function of those organs. They believe that by affecting the function of those organs in the abdominal cavity, that's what increases the risk for disease. So waist circumference is a very good indicator of visceral fat. There's many different methods to measure waist circumference. So in your book, it indicates that you should measure at the narrowest part of your waist. The tape should be level. You don't compress the tape into the skin. You can use a spring-loaded tape measure that works well to take the measurement. We usually take it from the side, and it's taken after a normal exhalation. And this is a very simple technique. It's very objective. There's not a lot of variability between testers. And so it's a great simple test to do to identify people who might be at increased risk. Males, if their waist circumference is over 40 inches, females over 35 inches is a positive test and would indicate increased risk. And it's a great formative evaluation. So if you have someone who's in an exercise program, instead of going by weight, you can do waist circumference measurements to see if that depositing of fat in the abdominal area is decreasing. So I mentioned other ways. ACSM tests it differently. Some people give exact bony landmarks where you should take the test, an inch above the hip or whatever. So you just have to make sure you're using the data that is associated with the technique. So if you can't use a table that is based on a certain landmark. You have to have consistency. And so our interpretation is in chapter 11, and that's the data that you will use to interpret the waist circumference measurements. And the same thing, waist to hip ratio is another very good indicator. It's looking for those people who have increased visceral fat. And so what you're doing is you're taking a waist measurement and dividing it by the hip measurement. The hip measurement is taking the greatest girth around their buttocks area. The tape has to be kept level. And the thing you want to be careful of is that you're not taking the waist measurement right over their skin and then the hip measurement over bulky sweatpants, because that's going to alter the ratio. If people have increased fat, they might be embarrassed. And so you can always offer to people to do their own measurement. You just have to make sure the tape is level. So these are two easy to administer tests, and they're great predictors of what it says here, of mortality, and so that's death, more than using body mass index. Body mass index is just a calculation of your weight in kilograms divided by your height in meters squared. And it is not an indicator of what your percent body fat is. I mean, this waist to hip ratio would infer that somebody has increased fat on their body, but it doesn't tell us what the percent fat is. It tells us where the fat's located, and by where the location is, the person has an increased risk. So if we're actually measuring body fat, which is something research settings will do, or athletic populations will want to know what an athlete's body fat is to calculate desirable body fats. Instead of just arbitrarily picking out a weight, we can give them more concrete goals. Underwater weighing or hydrostatic weighing is considered the gold standard. It was one of the first tests that came out. It's considered very accurate to determine your body fat, but doesn't tell us where that fat is, and so it doesn't always tell us identify that increased risk population with that android fat distribution. It just tells us somebody has increased fat on their body. A person gets on a scale, they submerge themselves in water, they forcibly exhale all the water out of their lungs, and they get all the air bubbles out of their bathing suit, because those air bubbles will buoy them or lift them in the water, and their mass will be not accurately measured. So we measure their mass in the water, and then we also look at how much water is displaced. And from that, we can calculate body density. And from body density, then we can calculate body fat. So this is a very accurate, but it can take repeated measures. Sometimes it takes 5 times doing it to get repeated measures. It takes a certain amount of, not necessarily skill, but the ability to follow instructions. So it's not always most accurate in an elderly population or a youthful population because of their ability to follow the instructions to do the test correctly. It's not feasible in all settings. You can't do a community health fair and have your tank of water. It has to be done in a lab setting with specialized equipment. And also, some people are uncomfortable with submersing themselves under the water, which can alter their results. Bioelectrical impedance, or BIA, is an easy test to do in a community setting. It's non-invasive. We don't have to have people disrobe or get into water to do it. It's a very mild electrical charge is introduced into the body, and it's based on the principle that water and muscle which contains more water, will conduct electrical impulses more rapidly, whereas fat impedes the electrical impulse. So if somebody has more fat on their body, the impulse will be slowed, and it then can calculate a higher body fat. So it is considered valid, but you have to follow the pre-test instructions. Its greatest factor that makes it inaccurate is the level of hydration. And so if the guidelines are is that people don't eat or consume a beverage within 4 hours. If they have more fluid, it's going to look like they have more muscle, and it's going to make somebody look falsely leaner. If somebody exercises, they shouldn't exercise within 12 hours because they're going to have lost fluid, and then it's going to make them look like they're fatter because there's not as much water. So the body's going to slow the conduction of the impulse. Alcohol also can dehydrate people. They should have gone to the bathroom within 30 minutes of the test, and they should not consume diuretics like chocolate, caffeine, some soft drinks, because diuretics are going to cause you to lose fluid, and then the test will make you look more obese or overweight. So it can be a good test for formative assessment. Somebody's in a weight loss program. Instead of going by a scale weight, doing body fat, it's an easy test. It's inexpensive. And the thing is, you should always do it at the same time. If you're doing repeated measures, do it at the same time of the day and under the same guidelines. And then skin folds is an easy test. It's based on underwater weighing. BIA is also based on underwater weighing. It's one of the most popular and practical methods. It's easy to use. The problem is it takes some skill for the tester, and it's going to be variable based on the tester's ability, but also the skin folds that are used. So you should use good quality calipers like a Lang or a Harpenden caliper. So subcutaneous fat, the principle behind skin folds is that we have fat underneath our skin, and by taking measurements at different parts of our body, so there's a chest measurement, there's a measurement on the back, the thigh, the hip, the abdomen. So we take these different measurements from different sites of the body and then put them into these very specific formulas based on population. So the population specific formulas where those came is that they would take maybe 20-year-old basketball players, and they would do take these measurements. Then they would also do underwater weighing, and they would try to come up with a formula with which skin folds from different sites are most accurately predict their body fat. And so we say there's population specific formulas that are based on gender, age, sport participation, the socio or ethnic groups. To be the most accurate, you'll pick a population specific formula, and those you'll see a variety or of some of those that are in your book. But then there's also generalized formulas. And so for your assignment, that's what you'll be doing, is just putting in the sum of 3 skin folds from 3 sites, and those will go into the a generalized formula. So the pros and cons of skin folds. Pros is they're inexpensive, they're pretty quick, easy to use if you're skilled. The cons is that it is reliant on the person's skill level and the ability to get a good, accurate measurements. Women or people who deposit a lot of fat, who are over fat, it sometimes can be very difficult to pull the fat away from the muscle. And so people who deposit a lot of fat in their thighs, it can be very difficult to get an accurate measure. Bod Pod is a similar principle to underwater weighing. It does calculates body density. But it's a much easier test. It looks at, instead of water displacement to calculate the volume of your body, it does air displacement. And so you go into this little chamber and you sit in this little chamber, and you don't have to forcibly exhale all the air out of your lungs, and you don't have to do multiple tests. So it's really quick. It's very easy. The main disadvantage to the Bod Pod is the cost. It's an expensive piece of equipment, and it's also difficult as far as portability. So therefore, it's used mostly in research settings and within a athletic population. So it's considered to be very accurate as hydrostatic or underwater weighing. Some studies have shown that it slightly overestimates some athletes, but it's still considered one of the most accurate. And so on the left is the Bod Pod. You can see it's just a little chamber you sit in. And then on the right is an example of bioelectrical impedance. There's other types. This one has electrodes placed on the hand and the foot, but there's other ones where you just stand on a scale, or there's ones where you just hold onto a device with your hand. So it's considered one of the easiest, but you always have to tell people, if you're doing it at a health fair and they haven't done pre-testing, that it is variable based on their level of hydration. And then one of the most accurate is using X-ray, considered one of the most accurate, used more in a research setting. You're not going to see it being done in a general setting because of the exposure to X-rays, but also machines are not portable and they're very expensive. So this, there again, is used mostly in a research setting.